Welcome to the Pharmacy Frontiers podcast, a podcast dedicated to the profession of pharmacy. Today, we're excited to turn over the podcast to the students from the St. Louis College of Pharmacy at the University of Health Science and Pharmacy in St. Louis with their podcast titled Dose of Knowledge. We give credit to Professors Stephanie Lucas and Terry Walholick for mentoring these students for these leadership podcasts. Let me remind everyone that the Pharmacy Frontiers podcast is available for streaming on your favorite podcast streaming app, whether it be Apple, Podbean, Spotify, or YouTube. The comments and opinions shared today are those of the hosts and our guests and are not official statements of the Missouri Pharmacy Association, Mitchell Pharmacy, Mercy, nor the University of Health Sciences and Pharmacy in St. Louis. Now let's hand the microphone over to our students.
Meet Elena. A few years ago, she sat in her doctor's office hearing the words that would change her life. You have diabetes. She walked out with a prescription and a long list of things she didn't understand. Blood sugar numbers, carbs, insulin, pills, and a lot of fear. This is the story of Elena, a 56-year-old woman who is struggling to keep her diabetes under control. Despite taking her medications and trying to follow her physician's advice, her blood sugar levels were all over the place. She felt frustrated, tired, and overwhelmed. But a few weeks later, something changed. She met a pharmacist who took the time to explain what diabetes really means, how her medicines worked, and how she could take control. Through medication counseling, regular follow-ups, and small but meaningful lifestyle recommendations, Elena slowly started to regain control of her health. Over time, her blood sugar got under control, and more importantly, she began to feel like herself again. Fast forward a few months, her blood sugars were stable, she felt healthier, and for the first time, she believed she could live well with diabetes. Elena's journey shows what can happen when a pharmacist becomes part of the care team. That's what this podcast is all about, talking about your pharmacist's role in diabetes control and why that is so important. Hi everyone, welcome back to the Dose of Knowledge podcast. During today's episode, we're going to be talking all about your pharmacist's role in managing diabetes. We're your hosts, Becca,
Nadia,
Anjana,
and Corinne.
As Tim and Dan said, we're students at the St. Louis College of Pharmacy, and we are all in our second year of pharmacy school, creating this podcast for our leadership and advocacy class. Today, we want to share with you how your pharmacists go above and beyond every day and can help you manage chronic diseases like diabetes. To give you some insight into our lives before we start, we thought we would go around and tell you a little about ourselves. So, my name's Becca. I've lived in the St. Louis area my whole life, and I've worked community pharmacy for the last year at the Medicine Shop in Peevely and the Ladue Pharmacy. I also did my summer rotation at a high-volume Walgreens pharmacy.
Hi, my name is Corinne. I am born and raised in St. Louis, and I've worked at Walgreens in the pharmacy going on 4 years now. I've also been giving vaccines for Walgreens all 4 years as well. I briefly worked at the Medicine Shop in Peevely with Becca. I am doing my winter rotation at Lindenwood Drug.
Hello listeners, my name is Anjana. I'm a pharmacist from India and moved to the States and now pursuing my dream to become a pharmacist here. I have 2 years of community pharmacy experience and I'm currently working as a pharmacy intern at CVS Pharmacy. I did my community rotation this summer at Walmart Pharmacy.
Hi, I'm Nadia. I've been living in St. Louis since 2008. I currently work as a pharmacy intern at the BJC Central Pharmacy. And I recently completed my summer rotation at Independent Pharmacy here in St. Louis.
All right, everyone, let's dive into today's content. We're going to provide you with a brief overview of what diabetes is before we bring in our content expert and guest speaker who divides her time between teaching at our school and working at Mercy's JFK Outpatient Clinic. We'll then wrap up this episode with a deeper dive into your pharmacist's role in helping patients with diabetes. I'll turn it over to Nadia to get us started. Tell us a little bit about diabetes, Nadia.
Thanks so much. I'm really excited to talk about something that affects so many people, diabetes. It's a long-term condition where the body doesn't make enough insulin or doesn't use it in the right way. So sugar stays in the blood instead of giving as energy. Here's a number that might surprise you. More than 38 million adults in the United States are living with diabetes. And it doesn't stop here. Nearly 98 million more are at risk, which means 1 in every 3 adults facing this challenge. Think about that. It could be your friend, your coworker, or even someone in your family. You probably know someone who is struggling. That's why this podcast is for you. Whether you have diabetes, know someone who does, or just want to learn how to stay healthy. We are here to make it easier to understand and control diabetes in everyday life.
Did you know that there isn't just one type of diabetes? Let's break down the main types and what makes each one different. In reality, there are 3 types of diabetes: type 1, 2, and diabetes developed by pregnant women. Type 1, this affects about 5 to 10% of the population. Unfortunately, you cannot control it without taking daily insulin injections, which is needed to use the sugar in the body for making energy. Type 2 affects nearly 90 to 95% of people, which is the most common one.
Corinne, does that mean certain people are more likely to get type 2 diabetes than others?
Yes, unfortunately, some groups are more likely to develop type 2 diabetes. It is more common in people aged over 45, those who are overweight or who have high blood pressure. We also see higher rates in certain communities, like Hispanic or Latino, Black, Asian American, and Native American populations. Now that we know a little bit about diabetes, let's bring in our guest speaker.
Today, we're delighted to have Dr. Challen, PharmD, MBA, BCPS, and BCACP, a healthcare professional with deep expertise in medication and patient care, to speak with us about her role as a pharmacist and managing diabetes. Let's start with the basics. What do pharmacists actually do to help manage diabetes?
All right. So thank you for having me, first of all. Pharmacists really do lots of different things to help diabetes, and it really depends on where you're practicing. So I'm an ambulatory care pharmacist, and that means I work in a doctor's office, and I help manage a lot of chronic disease states, including diabetes, to adjust medications. Most often that means insulin, so I look at patients' blood sugars and adjust the insulin as needed. But pharmacists in lots of settings help. In the community setting, they may be teaching patients about how to use their new medicine or how to use their new glucometers. On the hospital side, they may also be helping with adjusting insulin based on blood sugar readings.
That's really interesting. It sounds like pharmacists do much more than just fill a prescription. Dr. Challen, I'm curious, what does a typical day in your life look like as a pharmacist?
Sure. So like I mentioned, I'm in a doctor's office setting, and I have my own schedule where patients are scheduled to see me for one-on-one visits. And in those visits, I will ask them lots of questions, including which medicines they're on, what their blood sugars might be, lots of lifestyle questions, because we're always advocating for a healthy diet and lifestyle along with medications. And I'm possibly adjusting medicines if needed, ordering labs, and advocating for preventative measures as well, such as immunizations and, like I mentioned, healthy lifestyle changes.
You mentioned working with patients and reviewing medications. I've heard of credentials like BCPS and BCACP. What do those mean, and how do they help you take care of your patients?
Sure. So BCPS is Board Certified Pharmacotherapy Specialist. And then BCACP is more specific to ambulatory care. So that's Board Certified Ambulatory Care Pharmacist. This means that I took a test and passed the test. But it just means I focused more in on either pharmacotherapy or just ambulatory care in general. And you mentioned, how does this help my patients? Well, in order to keep up these certifications, I have to complete certain continuing education, more than my normal pharmacist license would need. And oftentimes I find that they're really helpful. They keep me up to date, and it helps me to then help the patient by staying up to date.
That's interesting to know. Could you share an example of a time when your expertise as a pharmacist really made a difference in one of your patients' life?
Sure. So I love getting to know my patients, and that's kind of what drew me into working in the ambulatory care field. And we get to hear all about their life and what they've been through. I have lots of ideas in mind, lots of patient stories, but one that comes to mind is a patient that had recently had a heart attack. He was now back home. He had been discharged from the hospital, and he met with me, and we identified lots of ways for him to improve his health, including stopping smoking and eating more healthy meals, home-cooked meals. And he told me that he left my office that day, went outside, threw away his pack of cigarettes, and never touched them again. And he started exercising. He lost some weight. We were able to stop some of the medicines in time. And he just made a full, huge change in his life. And you could tell by his improved labs, positive attitude, his outlook on life tend to improve. And that's just one minor example of how I felt like our advice had really hit home with some patients. There have also been times where I've met patients that may not be able to read. And I can recall, we didn't know why this patient wasn't filling her medications right. It turns out she was unable to read the medication label and was afraid to tell us. But we drew pictures on them, so suns for daytime, moons for nighttime medicines, and then with that, she was able to start taking it appropriately. And so it's just listening to them, meeting patients where they're at, and helping to, make changes that make sense for their lives.
Yeah, those are really powerful and touching examples. It really shows how pharmacists can make a real difference in people's lives, especially for something as common as diabetes.
And we want to say just a huge thank you for your time today, Dr. Challen. We appreciate the insight and expertise. And now we want to dive deeper into the pharmacist role and give you all some examples of what that might look like. Corinne, how has pharmacy evolved to get us to where we are today?
Pharmacy has changed in amazing ways over the last 50 years. Pharmacists mostly handed out medicines. If you want to hear more about that, take a listen to our Peers podcast on pharmacy history. But today, we do so much more. We care for our patients, teach them about their health, and work side by side with physicians to keep conditions like diabetes under control. Pharmacists get extra training so we can do more, like giving vaccines, adjusting medication, patient education, working with insurance, and helping patients right in our communities.
I know pharmacists can work in both neighborhood and hospital, but what exactly do they do to help patients stay on the top of their diabetes?
I can say with confidence that pharmacists make a big difference in managing diabetes, whether in your local pharmacy or in hospitals and clinics. They help patients every day by explaining how to take their medicines, teaching them how to check their blood sugar, and giving advice on healthy living. Clinical pharmacists often worked in hospitals or clinics. They work closely with physicians and nurses to choose the right medicines, adjust doses, and make sure treatment is safe and effective. Even though they work in different places, both types of pharmacists have the same goal: to help patients keep their diabetes under control and live healthier lives.
Wow, it's great to hear how much teamwork goes into keeping patients' life healthier.
Yeah, it sounds like diabetes care goes far beyond just taking medicine or checking blood sugar. How do those relationships with healthcare providers like pharmacists, doctors, or nurses help people stay motivated and on track?
Absolutely. And you're right, controlling diabetes is so much more than just taking medication or checking numbers. It's about people. It's about support, encouragement, and knowing you have someone in your corner. It's really helped to stay in touch with your healthcare team. Talking regularly with your doctor, nurse, or pharmacist can keep you motivated and give you the support you need. Making changes to your health isn't easy, and that's okay. Having someone who listens to you and understands your story can make a big difference. Regular check-ins also help you stay on the track and remind you that you are not doing this alone.
What tips do you have for someone ready to make a change but unsure what to do first?
Here's a tip that could make a huge difference. Sit down with your pharmacist and have an honest conversation. Talk about what's really motivating you and what's holding you back. Pharmacists can guide you in a way that helps you discover your own reasons to make a change. And that's huge for creating a lasting habits. Even if you're just starting to think about making change, this conversation can help you set goals you can actually stick to while building a connection with someone who's always there to support you.
Taking medicines every day can be hard. How do pharmacists help patients stay on track with their diabetes treatment?
One of the biggest and most important roles of the pharmacist is helping you take your medicine not only the right way, but also consistently. Pharmacists can offer personalized advice to help patients not only use the medication properly, but also to improve how often you're taking the medicine. This can be helpful tips on when to take it, simplifying your dosing schedule, or enrolling you in a medication synchronization program. Where I work, that program looks like us calling you 5 days before you're going to run out of your medicines. We go over the list of your monthly medicines you get to ensure that any changes have been noted and that you do truly need everything on the list. Not only does this ensure you get all the medicines you need, but it also creates an opportunity to engage with the healthcare team. When the pharmacist reviews the list and medications, it gives them a chance to reach out to the patient if they notice they aren't getting a medication and figure out why that might be.
I have a question for you, Rebecca. I know some people struggle with remembering their medication every day. How can pharmacists help make talking to them easier?
Yeah, without a doubt, to make it a little easier to remember, we have blister packs that are available for like a single medication, or we even have bigger ones available for your entire medication list. We'll put your monthly meds into these packs, and they'll be labeled with the date, which medicines are in each color-coordinated slot, and when to take them. So you can change it to be like at morning, noon, evening, or bedtime. This is a really great option for people with lots of medicines or those who have trouble remembering to take them. It's super customizable and it really just helps simplify your routine.
That makes so much sense. Thank you for explaining it so clearly. Rebecca, sometimes medicine doesn't seem to work or cause side effects. How do pharmacists help make sure patients are on the right treatment?
Yeah, so pharmacists are always personally reviewing all of your medications to ensure there are no problems and that the best treatment is selected for you. They work closely with physicians and nurses to make sure that each patient's treatment is working well. So, for example, if a medicine isn't helping you enough or it's causing problems, we can talk with your doctor about what might work better. Don't forget, your pharmacist is on your side. They make sure you're taking your medicines correctly, that you don't run out, and even help you save money by figuring out insurance and cheaper options. That's why people trust them. They help you stay healthy without breaking the bank. And their support doesn't stop at medications. Pharmacists also help you manage the chronic conditions like diabetes. People with diabetes monitor their blood sugar to measure how well the diabetes is controlled. You may have heard about something called A1C. Dr. Challen, what is A1C and why does it matter for those with diabetes?
So A1C is actually the hemoglobin A1C, and what that means is it's the average of someone's blood sugar over the last 3 months. And so when someone has diabetes, for most people, we aim for an A1C of less than 7. There's always some exceptions. But if you're less than 7, we say your diabetes is controlled. And if it's higher than that, then it's uncontrolled, and we'll likely be looking more closely at the readings to see if we can make any adjustments to help.
Anjana, I have a question for you. For people listening who have diabetes, how often should they check their blood sugar? Does it change depending on the type of the medicine they take?
That's a great question, and I think a lot of people listening might be wondering the same thing. So if you take diabetes medicine that is not insulin, you might need to check the blood sugar every day. Your doctor will tell you how often to check based on the medicine you take and your blood sugar levels. However, people who use insulin, they check their blood sugar more often. They may be using a small device called continuous glucose monitor that checks blood sugar all day long. So you might be wondering what a continuous glucose monitor is, right? It is a small device that checks your blood sugar continuously throughout the day and night instead of pricking your finger each time. So next time you are at a pharmacy and aren't sure which blood sugar meter or testing strip to pick, don't hesitate to ask your pharmacist. They are there to help you. And did you know some pharmacies even do A1C testing? How convenient is that?
We've talked about how important to control diabetes. But here is what really excites me. Pharmacists play such a huge role in helping people understand and take control of it. Can you tell me more about how pharmacists educate and empower patients with diabetes?
Yeah, sure. I'm so glad that you asked that question. Pharmacists are one of the most easiest and trusted resources when it comes to questions about your health. One of the main role pharmacists do is to help people understand their medicines. They explain what each medicine does, how to take it, and what to look out for. For an example, they show patients how to use their insulin the right way, how to check their blood sugar, and what to do if the numbers go too high or too low. They can teach the patients how to control their diabetes, which includes anything from healthy eating and physical activity, checking your numbers, and so on.
I know being active is important, but how much and what kind of exercise should I actually do?
Your pharmacist can help you get more active by suggesting a simple fitness routine. If you haven't been exercising regularly, start slow and build up. Going from zero to a full speed too quick can be hard on your body. Experts recommend about 90 to 150 minutes of moderate activity a week. Moderate just means anything that raises your heart rate, like a brisk walk. You don't have to be out of breath or dripping in sweat. A simple walk can make a big difference for your health.
Another educational conversation with your pharmacist might be centered around creating a healthy meal plan. They can help you develop an individual plan that works for you personally and what you can stick to. A diet doesn't work if you can only maintain it for a week. We're looking to make sustainable lifestyle changes. To give you an example of what this conversation might look like, we have some recommendations from the American Diabetes Association. So I want to imagine your plate in front of you split up into quarters. They recommend that half that plate be filled with non-starchy vegetables. That's things like broccoli, asparagus, or Brussels sprouts. And then the next quarter, they recommend that be filled with grains, your starchy vegetables, beans, or even lentils. Foods like beans and lentils have a lot of great protein and fiber, and they're also a super cost-effective option. I'm a broke college kid, so I'm always thinking about the money. And then they also recommend for that last quarter of the plate be filled with protein. The ADA recommends lean meats and low-fat cheese, and to give you a visual, roughly 3 ounces in size, which is the palm of your hand. We've linked some resources down below if you'd like a visual, and the PDF also includes suggestions for some foods that go in each part of a plate. Now we've talked a lot about patient education and that part of the pharmacist's job. Let's discuss the self-monitoring and problem-solving aspect. Corinne, why is regular contact with your pharmacist so important?
The last big thing we want to talk about is how your pharmacist is a great addition to your support network, as they can offer routine follow-ups to assess your progress and keep you going in the right direction. They can offer personalized consultations and motivational interviews to bridge the gap between appointments with your physician. This can help improve your overall health and allows the pharmacist to better collaborate with your healthcare providers.
Thanks everyone for your time and ears today. We know it was a lot of information really fast. We hope you enjoyed the podcast today, and we want to highlight again the big takeaways from this episode. If you take away anything from today's podcast, remember this.
The major point is diabetes can be overwhelming, but you have free resources at the tip of your fingers. Pharmacists are some of the most accessible healthcare providers and can be regularly contacted. They can offer unique and personalized advice to help you manage your chronic health conditions and live your best life. They do more than fill prescriptions. They're a trusted resource in helping people manage chronic conditions like diabetes. Most of all, pharmacists are here to listen and support. Taking care of diabetes can be hard, and having someone you can talk to, right at your local pharmacy, can make it a little easier. From medication guidance to lifestyle support, they're here to help you live healthier. They can provide crucial follow-ups to help monitor your conditions and check in with you. They help keep up with you in between visits to your primary physician and make sure your medications are working properly for you. Pharmacists are on your side to provide guidance, counseling, and resources to help you live your best life. So the next time you pick up your medicine, remember, your pharmacist is more than someone behind the counter. They're part of your healthcare team, and they're here to help you in every step of the way. You've got this.
Thank you so much for listening. We hope you learned something new or found something useful today and enjoy the podcast. We'll share links and extra resources below for anyone who wants to learn more about managing diabetes. Even though we are just pharmacy students, we'd be happy to help you connect with the great resources or pharmacists who can give more advice. Wishing you all the best on your journey with any chronic health issues. And big thank you to Tim and Dan for letting us share today.
A big thank you, students, for hosting the Dose of Knowledge podcast as part of the Pharmacy Frontiers. And thank you to our listeners for joining us today. Please share this episode with your friends and seek out other Dose of Knowledge podcasts on the Pharmacy Frontiers podcast page that can be found on your favorite podcast channel.